unusual moment where it just, something came up for most people the day of. So, but it's good to know that we can reschedule in the future.
It's just now 1:30, and it looks like most of the waiting room is cleared. But if you don't mind really quick, I wanted to introduce Kelly Sheets is on the call today, and she is going to be working with me on tackling all the MAC and TACs. And then when I go on maternity leave in March, she will be your main contact until I get back. So you'll start seeing her name on some emails and things. So I just wanted to let you guys know in case you started seeing emails from someone other than me.
Well, good to meet you, Kelly. I think we can go ahead and get started. We have a quorum.
And your waiting room is clear. So I'll turn my camera off and turn it over to you.
All right. Thanks, Erin. Yeah, welcome everyone. Thanks for taking time to be with us this afternoon. I think we have all of our TAC members present. So I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health, and I chair the Consumer TAC. And I'll just call on our other members to quickly introduce yourselves. We have Christine, Arthur, Miranda, and Patty.
Okay, I can go. I'm Christine Jackson, and I'm representing AARP.
Arthur may not be able to speak on the call because his interpreter wasn't able to be there right now. So Arthur Campbell with PNA. And Arthur, if you want to put anything in the chat, feel free to. Miranda and Patty, can you unmute and introduce yourselves?
Sure. Hi, I'm Miranda Brown. I'm a connector and outreach coordinator for Kentucky Equal Justice Center.
Patty, are you able to unmute? And I don't think you necessarily have to have your camera on at the moment until we take a vote, but if you're able to, that would be fantastic. She might be having some difficulties with her connection. All right, we'll move ahead. I think we do technically have a quorum, whether or not Patty's able to put her video on. So that's good. And I'd like to move to approval of the minutes from the previous meeting. Now, the minutes, technically, this is a transcript from our last meeting, and that's what we'll be receiving from now on. But we still need to have that approval. And I understand that none of us are probably going to read it word for word, but if you've been able to just skim it, and we can tell that, it's basically covering what we discussed at the last meeting. I think that's really all that we need. And this would be approval from the last meeting in which we did business, which would have been, is that June? I think it would have been our June meeting.
You can approve the June and the August minutes.
Okay, so we have August minutes. I'll ask for a motion to approve those minutes.
I'm sorry, I don't think I've seen the August minutes.
Yeah, I was going to say the same.
I'll go back into my sent file. They should have been sent, but I'll make sure they get back out to you guys. If you want to approve the June minutes and then approve your August minutes.
Yeah, I'm not too concerned about our August minutes because we didn't really conduct any business. So I was just assuming that we would approve the June minutes. So we can go ahead and do that.
Make a motion to approve the June minutes.
Thank you, Christine. Can I get a second?
I second.
All in favor, say aye.
Aye.
Aye. Any opposed? All right, minutes are approved. Good to see you, Patty. So we'll move on to our old business, and we have a number of items here that we like to follow up on. The first is the status of DMS's proposal to spend a portion of the FMAP funds to pay the onboarding costs for PDS employees.
So that was approved in the original spending plan. for the ARPA funds. However, when the budget bill passed and we were directed to use those funds towards the mandated 10% increase in fiscal year 23 and the 10% increase in fiscal year 24, that removes the ability to use, actually it takes care of all of those funds. We have no additional funds left to be able to do that. We still are in the process of that. The revised spending plan is still with CMS for the approval to allow us to do that with the for the rate increase. We have not gotten an official word back. They've asked us a couple of questions and we've answered, but we haven't gotten anything official back from them yet. But unfortunately, that was one of the casualties.
Thanks, Pam. So when you say casualty, you're expecting that when you do hear back from CMS, that this piece of it won't be funded because of the rate increase? If they approve, yes. So, right. If they approve, so CMS approves the revised spending plan that we had to submit as a result of the budget bill, then it will take all of the funds from that we were projected to get from ARPA. It will, in fact, it won't even cover 100% of the state share. So, I mean, it will take even more than that to cover that rate increase. So there will not be any of the activities that were previously approved in the spending plan were replaced with that new spending plan. Now, that doesn't mean 100% that we are stopping with everything, you know, because we feel like there were valuable things in that spending plan. So we are still trying to figure out how can we achieve some of those things without it being through the ARPA, you know, through the spending plan. So we still are trying to we're working with Guidehouse. You know, we're looking at it through the rates. There's some other alternatives we're looking at with the, about maybe rolling the onboarding cost up into if we do kind of a revamp how we do the FMA services of PDS and maybe have only, you know, 2 to 3 entities across the state that truly do financial services, that maybe making those onboarding costs be part of their reimbursement. So it's just part of that cost. So we're trying to find an alternative to what it is right now. But it slowed us down a little bit with, you know, while we're in limbo waiting to see if CMS approves that revised spending plan. Then unfortunately, all of those dollars were used towards that. But we are still recognize this is a problem. We want to fix it. It just will take me longer and some more creativity to try to get to the end to fix that. Okay. All right. Thanks for that explanation. Arthur, did you have something you wanted to say or ask? Well, Pam, one question that I have as a follow-up is, you know, for these various sort of alternatives that you're looking at, do you have a timeline at all, how long it could take, or even a range of, you know, 6 months to a year or any sort of ballpark?
For this one in particular, I would say we, you know, are definitely looking at next year, although I realize now it's the 18th of October and next year is not that far. It's not that far away. But I would think this is more of at least 6 months to a year. I hopefully can have a better update for that by the next meeting. I can have some more information. Hopefully we're going to get our feedback from CMS and know 100% what the direction is from them as far as the if they're going to sign the revised spending plan, or because if they chose not to approve that spending plan, then we would revert back to our original approved spending plan. So it's really, you know, right now we're in a waiting game for them to make their final decision.
And you don't have an idea of when they're going to make that decision. There's not a deadline, right?
There's unfortunately not a deadline. Now I've sent another, the end of last week, I sent another inquiry to my contact with CMS that does our spending plans, asking for an update, and I have not heard back from her. So I will follow up again we'll follow up again next week. But in the meantime, the one activity that was part of that spending plan that did continue because it is critically important is the rate study, which I know that it's down on the agenda. So I'll give an update on that in a minute when we get down to it. But that did not stop, and that one absolutely will continue.
Okay. All right, great. Anything else related to that before we move on? And Arthur, if it would be easier for you to follow up, by email, that of course could work as well. You just let us know.
That's what I was going to tell him if he needed to, if he wanted to email me.
Yeah. With any questions.
With any questions, I can get back to him. Okay,
great. So the next item here is the PE Medicaid data request, so presumptive eligibility. I think we've asked in past meetings, and we're waiting on the data to know how many Kentuckians were covered under PE Medicaid in February of 2020, so right before the pandemic started, and then the average enrollment per month in 2019.
Emily, this is Veronica Judy Cecil with Medicaid. That was sent back on August 16th to the TAC. So we're happy to resend that out, but we did include between February of 2019 and let me see what the other date was, and December of 2020, the monthly number of PE.
Thanks, Veronica. Miranda, this was the item that you had wanted on the agenda. Is there a follow-up here or anything else that you're looking for?
I'm sorry, I'm looking for the email to see.
We're happy to resend it. I just wanted to make you all aware that it was sent.
Yeah, we appreciate that.
Sure, and they're new members, so happy to do that.
Thank you, Veronica.
Sure. I do think resending would be helpful. Feels like there are a few things that maybe either didn't make it to us or maybe it's just been too long. Oh, here, I do see it from Aaron. So it's an email from Aaron. I'm so sorry, you all. And it does say 2019 and 2020. So we appreciate that. Sure how that slipped through the cracks for me. And Miranda, it looks like that was, August 16th at 2:30.
So I'm happy to resend it out just to make sure everybody has it.
Yeah, having it at the top of the inbox is always helpful. So we can review that, and then if there are any other questions or any follow-up, Miranda will add that to the next agenda, if that's okay.
Yeah, thank you. I found the email.
Okay, good. So the next item here is DMS disseminating the presumptive eligibility and emergency time-limited Medicaid flyer. So this is a flyer that Miranda created with Kentucky Equal Justice Center, and then DMS did, review it and approve it for dissemination, but we were really hoping that DMS would send it out to providers and connectors.
Yes, Commissioner Lee had asked us to take that back and change it a little bit since it'll be coming from us. And I'll just be perfectly honest, in all the things that are on our plate, that just sort of got pushed aside. And I know you guys are interested in us getting that out, but we want to make sure we do it accurately. And so we'll, hopefully by the next meeting, we'll be able to say that it's actually gone.
Well, thanks for the update. And I know that we have emergency time limit and Medicaid on the new business part of this agenda too, because we know that DMS is making some changes to that program. So it may be that having, updates based on the new process will be helpful too. So the next item we have here is the HCBS rate study work group, which Pam, you mentioned a little bit earlier. Do you have any other updates there?
So we are actually we're having a small group meeting internally. I have with them this afternoon, and then we'll be getting a larger group meeting scheduled in November. But also in November, we're going to have some smaller work groups that'll focus on really getting to particular like provider groups, like case managers, or, Arthur, this may be something, if you're interested, I may ask you if you can participate from a PDS perspective, where really to get, that additional information to make sure that we get this, right and have all of the input. That's all going to happen in November. And then we are looking at targeting the very first of the year. So within January, February, that first quarter, having the rates established. They'll go out for, they'll be posted for public comment, go through all of the approval process, but really excited to see when we get those out there. There's a lot of hard work that's been done on that, a lot of feedback that we've received from people, but we have steadily been moving forward with that information. And so a lot is going to happen the last quarter of this year into the first quarter of next year with rates, a lot of positive forward progress.
All right.
Hey, Arthur, I'll email you some details, okay?
Yeah.
Okay.
And Arthur, we can't hear you. Your microphone is working, so that's good to know.
Yeah.
All right, thanks for that, Pam. The PACE program rollout, do you have any updates on how that's going?
I do. So we have 2 PACE organizations that are live right now and are enrolling individuals. That's Bluegrass Care Navigators and Horizon. And I am not going to tell you the counties because I am going to get them wrong. We're updating the map and it's getting posted to the website, but we actually just approved the 6th individual for Bluegrass Navigators today. So as of November 1st, they will be serving 6 individuals. Horizon has been completing several assessments, and so they're anticipating enrolling several people in November. And then actually just a few minutes ago, I asked Erin if she could hear the fire alarms going off in the background, because I'm actually on site at a PACE readiness review for our provider that will be serving Jefferson County, that will be hopefully targeting on enrolling individuals by the end of the first quarter of next year or the beginning of the second quarter.
I think we lost your audio. You might just be breaking up on us.
Oh, I am in a basement as well. So
you're coming in clear now. If you can maybe just repeat the last 30 seconds.
Yes, so we are, I am actually on site with the readiness review for the organization that will be serving Jefferson County. And so we anticipate them to be ready to start onboarding individuals by the very end of the first quarter of next year or the beginning of the second quarter of next year. So in fact, if you all heard fire alarms going off in the background, they were testing the fire alarms just a second ago. So
yeah, your microphone is working really well at not having all of that background noise, but it's good to hear that things are starting to roll out. Is this the Louisville provider? Would that be the 3rd provider?
They will be the 3rd. Mm-hmm. They are.
And are you also onboarding other providers?
We are. We have. I believe there were for sure 2 others. I can't remember if the 3rd one got in on September 30th. Submitted their documents to CMS for their 90-day review. So we have more that are in the process. So we're slowly, it's still going to be a slow rollout, but we are making very positive forward progress. And we're working on, Kelly's has the website up and has been putting additional, information and resources up as she can. We are going to work on maybe just an informational webinar that we'll probably record and just put out on the website just for people to understand what PACE is, because a lot of people just don't really know exactly what it is and who could benefit. And we really see this as being kind of more of a collaborative effort with our current waivers, because we see where there may be some individuals that are currently being served most likely by HCB, but may benefit more from a PACE approach if they need a higher touch or more coordination of their care, as well as the PACE provider could also be a referral source back to a waiver if they have somebody that enrolls with them, but maybe really doesn't want that intense or that, that much engagement would really just want somebody to maybe come in 3 days a week to help them with their bath, and they have family that can help them. So we really see the two of them interacting and working together, and they're being referrals kind of back and forth between the two of them as to and collaborating on what is the best option and what's the choice of the individual, because at the center of it is what does the individual want. But I'm really excited. It's going to be a benefit to a lot of people, I believe.
Yeah, I think a video sounds like a great idea. Do you have a number of people that you think will be eligible and will be able to enroll in PACE?
I do not have it right here with me, but I have a sheet that I can share. And I think there may be a presentation that's posted that has some details on it, but I don't have the numbers in front of me. Now, it's going to take us a little while to, we've been enrolling about 2 people, max of 3 people a month. So, it's going to take us a little while to get to what seems like a significant number, but I'm excited with the continued progress that we've been making.
So you had mentioned choice, and when you say that, just to clarify, do you mean that people will be able to choose which services they get through the PACE program versus through a waiver program, or would they have to choose between participating in PACE versus participating in a waiver?
Yes, so they have to choose between. They can't be enrolled in both.
Okay.
But they, even though still within those, they get to choose. What services that they want to receive from that provider and what their plan of care is going to look like. But no, they could not be enrolled in both of them at the same time.
Okay. Does anyone have questions about PACE or anything else you want to add? Well, Pam, when that video is ready, and if there's any, sort of public facing materials, that if you can share that with us, I think that would be great. We'd like to get it out.
Absolutely. We will do that.
Thanks. So the next item we have here on the agenda is the Kentucky Medicaid Quality Strategy Project. And I'm curious, I did see a public comment period that's open, and I'm wondering if it's for the same thing.
Yes.
We can just get a little bit more information about how all of that's going to work.
Well, it is out on our website right now, and Erin did send that to all the TACs. It is out for public comment, effect starting on September 26th for 30 days. So that ends on the 26th of October. So a little more than a week from now. So if there's any comments that you would like to provide, there is an email address on the announcement, or you can mail it in.
Thanks, Angie. Can you give us a sense of what the Medicaid quality strategy is right now and what could change based on people's comments? I don't think it's commonly understood what the quality strategy is.
Well, I mean, right now, the quality strategy, it's a CMS requirement that we have a Medicaid managed care quality strategy at least every 3 years, updated at least every 3 years. So the current one was done in 2019, but the one prior to that was in 2012. So there were some updates. For this quality strategy, we enlisted the assistance of Northern Kentucky University, utilizing the CMS toolkit and what was all required. And part of that was, talking to people like you, and others within the TAC, and the MCOs were involved, and we also utilized others from public health and behavioral health, or BDID, internal departments within CHFS. Basically, the quality strategy is to, provide like a, I can't think of the right word, but we're going to look at it like a Bible as far as, what we are targeting for the quality of the health of our quality of health of our Medicaid enrollee population. Obviously, with any type of quality measures, we know as a state that we're low on the totem pole, but we need to start, and we have. Now, the MCOs have done a lot of work on improving the health status of the enrollees, but we have a lot more work to do. So that it's the basis, that's the word I was looking for, the basis for providing and identifying and measuring the quality of health of the Medicaid enrollees.
So as you're looking at updating the strategy, are you looking at, potentially new quality measures that would be prioritized, new incentives that would be, sort of tied to those quality measures? Is that what this plan would be really focused on?
Well, the incentives are provided through the MCOs. I mean, that is what they would determine to help drive the improvement of the measures. But yes, the quality strategy does have certain measures that would be the priority. Not to say that anything that other things may not work into that, but it's general, but it's not. I don't have it all, and I should know by the back of my hand, but, diabetes and the issues that we have with that, SUD, maternal health, those are our main focus areas within the quality strategy and for the state. So based on, a lot of the data that we've had, and we know where Kentucky does rank in a lot of these areas. So it's, it will be reviewed at least annually, to see if there are any changes that need to be made, and also how we are doing as a state within our Medicaid managed care quality arena. So
yeah, thank you for that explanation. And I do think if there's an annual report or something that we can take a look at, and if there could be a short presentation to our TAC, that would be really helpful, just to really understand, where we're at with quality and, what sort of steps you have in place for making improvements in those areas. Does anybody have a question or anything they want to add here?
I can add that we do have a what we call a technical report that we submit to CMS every year. And that is on our website. So that does provide a lot of the information that that our external quality review organization does throughout the year, and helps us with the quality and this new quality. And the basis of that is usually tied to the, or not usually, is tied to the quality strategy. So with this quality strategy coming into effect in 2023, and the next technical report would be due to CMS at the end of April, that it would be associated with the 2019 strategy.
Okay. I think a presentation that would help distill it down and make it a little easier for, a little more accessible would be helpful. Sure. Because I know those technical reports can be pretty dense, but it's really good to know more about how this process works. And I would just encourage any of our TAC members to, before the 26th of October, to go ahead and submit your comments about, how Medicaid managed care can help to improve quality in terms of both, the quality of services and outcomes, which is ultimately where we want to get. So thank you all for telling us about that opportunity. The next item we have here, and stop me, anybody, if you do want to chime in with a question or a comment, is the stakeholder engagement opportunities regarding the PHE unwinding. I know that DMS has engaged Alterum to help with this, but wanted the TAC to get an update from y'all.
Absolutely. And I did join a minute or two late, so if this has already been discussed, I apologize. But
it hasn't.
Okay, so the public health emergency has been extended now to January 11, 2023. That means that our 60-day notice that CMS has committed to state Medicaid agencies to notify us if it's not going to be extended is November 12th. So now we'll be looking towards November 12th to see if we receive that 60-day notice and things start kicking off our unwinding efforts. We have We're still doing some internal review over all of the flexibilities that are afforded to the state, making sure that we're taking advantage of them. And then we've been doing a lot of internal communication development. So I anticipate more stakeholder engagement probably in the next 30 to 45 days as we finalize some of that information.
That's good to know.
Yeah.
And knowing the date that has actually been extended now and not having to wonder and wait is really helpful. One question I have for you, Veronica, I know some states are doing like a public dashboard so that people are aware of, I think probably how many people need to renew, what those demographics look like, maybe where they are at regionally or county by county. Is that something that DMS is planning on doing?
Yes, we plan a very robust dashboard, in fact, and should actually, we had a meeting on that last week to fine tune some of the things on it that we want to report, and that we'll be sharing that so we can get feedback if that's meeting the needs of advocacy and community-based organizations, because we know that you all are going to be a really important part of making sure that our members understand the process they're going through because they've never experienced it before. So yes, we're creating a website and plan to load sample or template letters that go to members so people can see what they're receiving. We'll have the reports on there. We'll have flyers. And we're also trying to consider specific populations like children, pregnant women, and others so that we can focus some of the communication along those lines. And so those are the efforts that we're undertaking right now.
Yeah, I think that all sounds like it'll be really helpful. Is there anything that members of the consumer TAC and advocacy groups generally can be doing right now to be helpful?
Just reminding people to make sure their contact information is updated. That's the kind of the key thing right now.
Yes, definitely. We know a lot of people have moved during the pandemic. So,
yes.
And I think you all have a toolkit with some of that messaging. I don't know, has that been shared with MAC and TAC members, or is?
No, we've not. I don't think we've posted that or shared that communication. But I can.
There are just a few messages that people could, easily kind of adapt or cut and paste. I think that's always helpful.
Yeah.
Make sure that we're all using the same language. Miranda, did you have anything to say there?
I think the toolkit with the shared messaging would be really helpful. Veronica, when you said that you anticipate more stakeholder engagement in the next 30 to 45 days, is that regardless of whether or not the PHE gets extended again, or is it dependent on that?
No, it does. We'll be moving forward with that regardless of where the PHE is.
Thank you.
Yeah.
That's good to know. All right. Well, thank you for those updates. Any other questions about this? Just so other TAC members and anyone really on the call knows, the Commissioner Lee is going to be speaking at KVH's annual meeting about the unwinding. So we're excited to have her join us and share some updates and talk about what advocates can do to help keep people covered once the unwinding begins. And that's on December 14th. So if you want more details, just let me know. Let's see, the next item we have here is the maternal health review. I know this review has been underway for a while now. Are there any updates?
There's not too many updates. We're continuing to work primarily with our MCO partners. They all have going on that are working to.
Dr. Thoreau, you're kind of breaking up on us. You were clear at the
visit
beginning.
rate postpartum.
Oh, no.
Is it better now? I hope
it is better now. And when it started breaking up when you said the MCOs have been working with us.
Oh, they are working with our with us all of them on different projects to improve the postpartum visit rate, and postpartum present some of that at the MAC next month. But it's ranging anywhere from incentive programs to the providers. They obviously have incentives for members, but several are also doing doula programs or doula pilots that you might be interested in. So it's kind of hitting it at all kinds of different angles with hopes that that we improve care.
Yeah, that's good to hear. I know that we had, I think it was, I hope I get this right, Humana, that was offering doula services initially, maybe a year or two ago when it started. And we had that on the agenda for one of our TAC meetings, but I think adding it back to the agenda and having other MCOs that might also be offering doula services share about, how that process works for their particular MCO and members would be really helpful. So we'll do that for the next meeting.
Oh, that sounds great.
Unless you think that'll be too soon.
Oh, yeah, I think that would be great because they're all doing something a little bit different or targeting different populations. And many of them are just getting started. So, or they just got started in this calendar year. So they should be able to have something to present at the next meeting.
And this is like an add-on sort of benefit that's still the way it's designed. But will it be on the side-by-side that people will get for open enrollment?
I don't know.
And I can't believe that I don't have open enrollment on the agenda. How did we? Oh, yes, we do. We have it on the agenda under new business. But yeah, the side-by-side has been like such a valuable, tool that we've used to educate Medicaid members about their options. And hopefully we'll have that again.
I mean, it is out on the website.
Oh, the side-by-side is already on the website?
Under open enrollment, yes.
Oh, great. I saw the recent side-by-side with the vaccine incentives, but I hadn't seen the open enrollment one. So that's good to know. We'll make sure.
Oh, I can bring it up later. Sorry.
There is a separate side-by-side just for maternal health also.
Oh, and okay. Erin, would you mind sending us all of the side-by-sides in one email so that we can make sure that everyone has the right information?
Yes, ma'am.
Thank you. Because those really are valuable and we like to distribute them as far and wide as we can.
Yes.
And so you're saying that the maternal health is going to be not on the value, what is it called, Miranda? That is it
value added
services side-by-side. It will be a separate one.
Well, if they have some incentives for maternal health, it would also be on the value add side-by-side.
Oh, okay.
There is just a separate maternal health that Dr. Terrio worked with the MCOs with and getting on all their maternal health programs are, basically.
Oh, okay. All right. That's good to know. So we probably still want to do the value add for open enrollment, but it's good to know that there's another one that gives us a better idea of what maternal health programs are in place. Is that meant for the public or is that meant more for providers, for the public?
Was the public and for providers, because we were thinking if you're seeing a woman for a prenatal visit and she asked, hey, what do I have available to me? The providers don't really know because there are 6 MCOs. And so then you can whip out your little sheet and know exactly what to tell her.
Okay. All right. That sounds great. Miranda, did you have anything else you wanted to add there?
No, thank you.
And then the last item we have under old business is next steps for Medicaid reimbursement for licensed certified professional midwives. Has anything else taken place since our last meeting?
No, we really do not have a timeline for that right now.
It's under consideration, but not really moving forward. Is that my understanding? Okay.
That's right.
All right. Thank you. Anything there before I move on? All right. So I'll move on to new business. And we still have a standing data request, just asking how many Kentuckians are currently covered under traditional and expanded Medicaid and also presumptive eligibility. So separate from the PE request that we discussed earlier. Are you putting that in the chat, Veronica?
I just put it in the chat.
Okay, perfect.
So for the record, we have, this is a snapshot as of August 1st, October 1st, 1,677,685 total in Medicaid. Of that, 1,518,906 are managed care. 628,637 are expansion population. I added Sky. You didn't ask for it, but I think it's a good number to report because we are very proud of the Sky program. 27,954 in Sky. And then our PE, and it's done on a weekly basis. So I added the most current weekly number as of October 17th is 1,394. We are averaging about 250 a month. Keep in mind for presumptive eligibility, they get 2 months of coverage. They're still under the PHE 2 periods that they can enroll in, but it's not done automatically. So they have to request that second period. So that's our current numbers.
Thank you. For Sky, I'm not sure if everyone is as familiar with that program. I know that kids in the foster care system are covered under the Sky program, but that number is very different. So are there also kinship families covered by Sky, or what makes up that larger number?
Sure. So I'm going to see if I can quickly pull up my cheat sheet on it, but it includes former foster kids, former foster adults can also enroll in Sky, so they can continue to receive some of those extra benefits. Let's see here if I can. One second. I did that to myself by adding in the number, didn't I?
Well, I don't want you to regret it. I think it's a great number to have. And if you don't have the answer for
I was gonna say
at this moment, Veronica, just an email would be great.
Let me find the populations that are.
I wasn't trying to put you on the spot.
Yeah.
Okay. It just occurred to me that I feel like the number in foster care, actively in foster care, is about 9,000, kind of ballpark.
So it is foster care, dually committed youth. So DJJ, juvenile justice kids. There is adoption assistance children, former foster care up to age 26. Children and youth residing in an adoptive home, receiving adoptive assistance. Let's see, it said DJJ youth. So not all of those are mandatory. The mandatory eligibility is foster care children, dually committed youth, and children 18 years of age that are under a commission. It's an eligibility, confusing eligibility requirement, but the others are optional, so they can opt to enroll in Sky.
That's good. That's helpful. Thank you. Any other questions about that? Any of the data that Veronica just shared? Veronica, I heard, and I wish that I had more of these details, but I heard that there were some families with children who were covered, I think dual eligibles, who were being covered, who were being taken out of MCO, managed care, and covered under fee-for-service?
So we are right now discussing taking individuals with third-party liability and moving them over to fee-for-service to make it a little easier on those members and providers serving those members. But that's under consideration.
It has not happened yet.
Right. Well, there's been no notice to members or providers. And if we decide to move forward with it, we'll send out notices.
One question that came up with that plan, or just what you're, considering, was whether the provider network would change significantly. And my understanding is that fee-for-service has a different provider network than the MCOs. Is that right? Providers can choose to opt in or out of fee-for-service.
That's correct. Although there aren't very many that don't serve fee-for-service, that are MCO only. But it does open up to the entire network unless they've decided to make the decision not to serve fee-for-service.
Okay. Well, that's good to know. And if you were to notify members, would it be of your decision, or would they be given a choice?
No, if we move TPL members over to fee-for-service, they would be required to be under fee-for-service.
Okay.
It wouldn't be optional.
Do you expect there to be a public comment period for that?
There's no comment period for it.
All right. Well, I know, at least for myself, and anyone else, feel free to chime in, I don't feel like I have a very good sense of how it would change for the members, aside from the provider network potentially changing. But if there's any information about what you would anticipate changing, good or bad, potentially for the members, I think that would be helpful. In some ways, it sounds like it would be less complicated, but I also know that MCOs have their own various programs and some of those value-added benefits, and that could potentially be a drawback for certain people.
Yeah, keep in mind that most of these people are working, they have third-party liability, maybe through their employer, and so they don't generally access a lot of the additional services that are offered, the value-added services that are offered.
Okay. That's good to know. Do you have an idea of about how many households this would affect?
It would likely affect around 81,000 people.
Okay.
It's a small population.
Thanks. Any other questions before we move on?
Yeah. So I'm not sure. I don't really understand what population you're talking about moving to fee-for-service.
So these are individuals, and again, I really hesitate to talk about it because we're not moving forward with it yet. But so these are individuals that have commercial insurance, and individuals that have Medicare supplemental, not Part C Medicare Advantage, but Medicare supplemental. We've encountered some complaints over the years around MCO processing of claims that have third-party liability, and bypass lists, consistency with bypass lists because Medicare doesn't cover some things, or commercial insurance doesn't cover things that Medicaid covers, services that Medicaid covers, and provider types that Medicaid covers. So we're looking at trying to create and reduce barriers to accessing those services, and for just trying to help administratively simplify for providers for having to process claims involving third-party liability.
So this would include, and I understand this is under consideration. So what you're exploring would include KI-HIP, like the Kentucky Integrated Health Insurance.
So KI-HIP is already a fee-for-service.
And then other commercial or third party. Yes. Okay.
Yeah. So keep in mind, when a member is in managed care, they're not in KI-HIP. So it would actually expand the population that we could potentially consider for the KI-HIP program, which is a really good program because sometimes we're able to cover, premiums that include family. So it really benefits a family sometimes to be part of the KI-HIP plan.
Right. Yeah, and for certain circumstances, I think that's correct. but I think it can also be more complicated for some families. So it is, I think, a case-by-case basis. But it sounds like this would work similarly to how it's already working with KIHIP. But for
KIHIP is very different than processing a third-party liability claim.
Okay. Well, I'm not trying to confuse anybody, so I think I'll just stop now. But thank
Happy
you.
to bring more information if
yeah, that would be helpful. It was something that someone brought up to me and had some questions, and particularly about the provider network, and I thought it would be worth raising here. So, but good to know that that's just still under consideration. So thank you for the updates. Where are we on the agenda? I think the next item here is feedback on the network adequacy one pager. And Angie, we really appreciate the work that you've done on that. Thank you.
I should have it back to you this week.
Okay. So I know that Miranda had made some suggestions, which I second those. Patty or Christine or Arthur, did you have anything else that you wanted to see in that network adequacy one pager? Okay.
Yeah. Did you say if there are any more questions about Medicaid? Yeah.
Well, I was asking about the network adequacy
okay. Yeah,
pager, but if you have other questions, generally, Patty, we can absolutely make time for those. Is there a specific question that we haven't gotten to yet? Okay. So I think with the network adequacy one pager, we're good. And once we have a final version, we'll definitely want to be circulating that. I know that you have it on, DMS letterhead. So it looks like something that you'll also be able to post and circulate. Do you have a plan for how you're going to share that information with members?
Not yet. It may not be on letterhead. It's where I started it, but I mean, all this information is in the member handbook.
I think it's just, it's easier for people to understand in the format that you've, put it in, which is really helpful. And it just kind of distills the process down and makes it a little easier for someone to follow. Personally, Miranda, do you feel the same?
Yeah, I like the format. When you say it's in the member handbook, do you mean the handbook that an MCO would send?
Yes.
Okay.
Regarding network adequacy and how they can help with finding a provider and contacting member services with questions. And
I think the information is there. It's just not quite as succinct and clear. And of course, every MCO has the information kind of written just a little bit differently.
I mean, I developed this for you all to utilize.
Yeah, no, we appreciate it. And we'll definitely circulate. I just wondered if it would be posted somewhere, if there's, a link that we're going to be using, that sort of thing. But
I haven't thought that far.
Okay. Well, maybe we can continue that conversation over email.
Okay.
Any other questions or thoughts on network adequacy? All right. Patty, did you have questions that you wanted to add under general discussion maybe, or was it something specific to what we've already covered?
Probably could have covered it up a couple of notches ago, but actually it's just a Michelle P question, and I can do that in general discussion. That's fine.
Okay. All right.
Whichever works.
Let's see. Is Pam still with us? I know she's at a site visit, so it looks like Pam is still on.
Yeah,
Pam, would it be better for you to cover that question now or in a few minutes? I think her connection is pretty bad.
Sorry, Emily, my connection dropped literally the moment you asked that question.
Yeah. Sorry for that timing. Do you want us to?
That's okay. It was just I thought.
Patty, why don't you go ahead and ask your question, and let's see if Pam can answer it, and if not, we'll revisit in a few minutes. Patty, what was your question about Michelle P?
Yeah. Okay. So are we ready for my question? It's just a quick one. It will not take long at all. And this just came up a few days ago. There were some family members that were applying for or checking on applying for getting on the waiting list for Michelle P waiver. And they were actually told that there's a 6-year waiting list to be able to get or obtain waiver services, particularly on Michelle P. And I think their questions were, is that basically correct? Is it a six-year waiting period?
I just got a message, Pam just got knocked off.
Okay.
So Patty, if you'd like to send that to me via email, I can send that over to Pam and get you some answers for that.
Okay, alrighty. Like you see, and it came from what they had done is there was a couple of parents that like from a couple different areas that I think it was like had been working with their case managers, and they had so they were going to sign up for get on the Michelle P waiting list, and so they were told that it would be that there actually I think the way they worded it was that there's a 6-year waiting list. So I'll just send you an email. That'd be fine.
Okay. She did say she's going to try to join by her phone to see if she can get back on. But to make sure you get an answer, if you don't care to just email me, that way we can make sure she gets it.
Okay. Okay. Will do. Thank you.
You're welcome.
All right. I think the next item we have. Thanks, Patty. The next item we have here is Medicaid open enrollment, and just knowing what the plan is there. Open enrollment started on the 15th. I can't believe that it's already halfway through October.
Yes, it started yesterday on the 17th, goes through December 2nd. Notices were sent out starting mid-September. So we always try to give at least a 30-day or early to mid-September. We always try to give 30-day notice. So it just opened. We'll get a report on the changes. Last year, there were about 9,000 changes. Keep in mind that this is not open enrollment like you traditionally think. This is just an opportunity for members to change managed care organizations. Medicaid is a continuous open enrollment. So we'll happy to keep you posted on that change.
Yeah, I mean, I think the decision that a lot of people, or the basis for making that decision for a lot of people is some of those value added benefits, provider networks, that sort of thing. Yep. So I'm assuming that the notice that went out to members included that side by side.
It did. Yeah,
great.
It did.
And is there? Oh, I'm sorry. I was just going to ask with Anthem. I know that there's an appeal process available to Anthem in terms of the Medicaid contract. But depending on that outcome, do you have a plan for what would happen with the members? Would they be auto assigned and then have the chance to choose a different MCO, or have you not gotten that far?
No, sure. Just a couple of things about that. So Anthem has requested a motion to reconsider at the Court of Appeals. So it'll go through that process. And then from that decision, they could also appeal to Supreme Court. So this, there are lots of additional opportunities of appeal around that. So we're still maybe looking at a significant amount of time.
So 6 MCOs kind of business as usual.
It is correct. Business as usual. In the event that Anthem no longer is a Medicaid managed care organizations, our contract sets forth how we distribute when that happens. But you are correct. So even if somebody is auto enrolled to an MCO, they always have 90 days from that date to change MCOs. They'll receive notice of that You know, obviously we'll want to make sure that those people are well supported during that period of time. So we'll do a lot of outreach around that if and when it happens.
Okay, but that is not on the horizon at the moment.
It is not.
Okay, thanks. I hadn't heard about the appeal decision. I assumed that would happen, but
yeah. I was going to put in a plug for the marketplace open enrollment. So
yeah, please do.
Because the health benefit exchange is now in the Department for Medicaid Services. So the health benefit exchange enrollment is November 1st through January 15th, 2023. So there is a little bit of an overlap there. But as you all know, losing Medicaid is a qualifying event for a QHP, qualified health plan enrollment. So just wanted to make note of that as well.
Yeah, thank you. Yes, these are all overlapping also with Medicare. And yes. Of course, a lot of families, you know, there's mixed status. Some members would be enrolled in Medicaid and others in a QHP. Yep. And just to be a good advocate, I have to say that the family glitch being fixed for this upcoming open enrollment and 2023 coverage it means that tens of thousands more Kentuckians would potentially be eligible for marketplace plans. So yeah. That's definitely something that we should all be getting the word out about. Yeah. Any questions there, Miranda, or any of our other members?
I just had a question about the side-by-side. I received it via email from an MCO rep, but I think it would be good for all connectors to get from the state somehow the value-added benefits side-by-side.
Yeah, I agree with that. Miranda, we could make that a recommendation, or I'm sorry, Veronica, were you about to respond?
Yeah, I was going to say, well, we're happy to make that request. Thanks for the suggestion.
Anything else before we move on? All right. So our next item is emergency time limited Medicaid. We talked about that a little bit with the flyer, but I know that there's a process in place to make some changes. Anything that you can share with us now?
Yeah, so there's been a little bit of confusion around emergency Medicaid, and we actually just recently, in the last 2 weeks, met with CMS to clarify what the state's required to do. And as a result, we're making no changes.
Wow, that is a disappointment. Okay. Can you explain a little bit more of how you came to that decision?
I'm not sure what more to explain.
Well, there had been a lot of conversation with the Deputy Secretary and others at DMS over the past 2 years about making some improvements about how people can enroll in emergency Medicaid, making that easier, and a process that, you know, is a little bit more public facing. I know that technically it's in the application, but it's rather ambiguous. And people also can only enroll at this point when they have an emergency rather than in advance of an emergency, which some states are doing. And I thought we had a commitment from DMS that was going to happen. So I'm just a little bit surprised by this.
Well, I'll take that back. But you know, based on our conversation with CMS, at this time, we weren't going to do anything additional. To be honest, we were a little concerned about some of the changes that they were asking us to make in terms of claim processing that we thought would probably be a little more burdensome for individuals getting access to the care they need by putting additional edits on the front end, instead of treating the situation case by case. So, I mean, certainly, Emily, I'll take that back to them.
Yeah, you know, the claim edit piece was really something that I think came from CMS more so than from advocates. We had, Miranda and I at least, and some others who have been talking with the cabinet about this for the past couple of years. We're much more focused on pre-enrollment, being able to apply in advance and be pre-approved only to be covered, you know, in the event that you had an emergency, but to give people, you know, that option and that peace of mind in advance, and to not leave it to hospitals and providers to, you know, sort of make those decisions about who they kind of assist in enrolling in emergency Medicaid, because it's just not a well-known option to people, and it's not very, it's just not very accessible. And I think that a lot of hospitals, you know, there are some that probably use it pretty routinely and consistently, and others, you know, it's maybe not an option that they either choose to use or that they tell people about. And it's very much based on, you know, whichever staff person or provider that you encounter. And that just doesn't seem provider or patient-centered at all. It doesn't seem like it's, you know, essentially accessible and equitable in those ways. It feels like it's very much kind of at the mercy of you know, who ends up treating you.
Right. And I think the other piece is if people are able to enroll in emergency Medicaid before an emergency happens, and that kind of makes them feel more comfortable to seek emergency services when they need them.
Right. One thing that occurred to us with the pandemic actually was that while technically we knew that emergency time limited Medicaid would cover COVID treatment, most people who would be eligible for it didn't know that and didn't know how to access it. And so instead, if you don't know that that's an option, then you just avoid care. And, you know, it ends up becoming a much more serious situation.
But like I said, I'm happy. I'll take that back to the commissioner and the secretary.
Yeah, I think we would appreciate a conversation. It doesn't have to necessarily be through the consumer TAC, but this is just a big change in direction. Anything else before we move on there, Miranda? Or any other member of the TAC? Okay. So the next item here is the onboarding costs. It may be that we just put this both in the old and the new. I'm not sure if there's more that we need to cover there for PDS employees, but Arthur, oh, it looks like you just made a comment. So we will put that on the agenda for our next meeting. Yes, I think that's a good idea. So then we have general discussion. Patty, was there anything else that you wanted to bring up here?
No, I don't think so.
Okay.
I believe Pam was able to rejoin. Pam, is your audio any better?
Yes, can y'all hear me?
Yes, we can.
Patty, did you want to ask her your Michelle P. question again about the waiting list?
Patty, did you hear the question?
Yeah, is Pam on there?
She's on now.
Okay, I'm sorry. Yeah, Pam, what I'd asked earlier was we had heard some comments from people that are trying to sign up for the waiting list. Primarily, I think what they were looking at was Michelle P. And so in their discussions with I guess case managers, other people on staff, what have you, they were told that if they did sign up for Michelle P, I don't know why they're not already signed up, but this was just like from a couple of different people. They were told that there is actually, they could go ahead and sign up for Michelle P, get on the waiting list. However, it was a 6-year waiting period. So I just wonder if that's still
accurate.
Yeah, there you go. Is that still accurate? Is there still a 6-year waiting?
It is
right now.
It is. We're between 7,900 and 8,000 individuals on the waiting list. I don't have, it's been a few weeks since I pulled the numbers, so I don't have the exact number in front of me. We are getting ready to allocate 350 slots on November the 1st, but the individuals that we are allocating to right now joined in 2015. I will say though, when somebody, so there's not I don't just decide I want to be on the Michelle P. wait list today and fill out that form like I used to. So we encourage them still to go to, if the case manager will help them do it, if their family is able to do it, because they can do it themselves after they do the Medicaid application, or if an ARDC will help them to do it, to complete the waiver application, because the answers that and the documentation they upload really gets them to the right place for where they're supposed to be. So it looks at what their deficits are. Do they have a developmental disability? Do they have an intellectual disability? Do they have a physical disability? And so that does a couple things. One, it makes sure that if they qualify for more than one waiver, that they get routed to every place they need to go. And then it also prevents them from potentially sitting on a waiting list for years at this point, to only, find out later that they really never qualified, that potentially they needed different services.
Okay.
Yeah.
Right.
So the application process is really meant to help with that, and to make sure that they get, if they need to be referred to multiple places, that one application will do that.
Okay. All righty. So is that so has that number been, has that been pretty much the basic number of years or is that just like 6-year waiting period, or is that just recent?
We've been staying close to that. We actually, for a couple of years, we were growing. We were adding over 100 people a week to the waiting list. That has stabilized off, and we're not seeing that growth. We also have been allocating slots. This will tell you how many people that are actually were added to that wait list that probably either one weren't even sure what they were requesting at the time, because all they had to do was fill out that piece of paper, or two, have since gotten services in a different manner. But we've been allocating slots about every 90 to 120 days since 2018. And we are just now, probably this will be our last, depending on how many people we get out of this allocation, this may be the last round of allocations that we do until we get the 50 slots approved that we were given for this budget year, which that's going we're getting ready to start working on the Michelle P. waiver renewal, and that will be added to that. But so that, we probably, out of every 100 allocations that we send out, we don't even enroll 50% of those people. And most of them, it's not that they don't qualify, it's that either we can't find them, or they just don't want to, they don't want to, they didn't realize what they were signing up for.
Okay, thank you. And just one other quick question, like on SEL emergency, is that at 0 right now?
It is at 0, yes.
It is at 0?
It is at 0. And we've added we've added the additional slots that we were given also in the budget for SCL. And that waiver is getting ready we posted response to public comment. There's one thing left to do with that waiver, and then it'll be sent to CMS for review and approval. But we're at 0. And I think we had like 100 and it was over 100 slots available in SCL.
Okay, thank you very much.
You're welcome.
All right. Yeah, thank you, Pam, for getting back on. We appreciate that. Anything else people want to cover under general discussion?
I have just a quick one on the Consumer Rights and Client Needs Advisory Committee website, where the agenda and the Zoom meeting is. The very first listing talks about the the 5 members representing, and I don't know if those organizations are right. I know AARP is not listed on there, so maybe it's something that doesn't get updated very often.
I'm in the process of updating all of the TAC websites. When I took over for Charlie, I started to find a lot of inconsistencies. Charlie wasn't able to update the website herself, so she was leaning on other people. So that is on my to-do list. It's not on my on fire to-do list, as I call in Medicaid, but it is on my list of trying to clean up those websites and making sure all that information is up to date as possible. So that I have been working on those.
Thank you, Erin. And I recalled that we had exchanged emails about updating the list. So I know you have that information. And one update I wanted to share with you is that the Frisky Coalition did get back to me, and I think they're in the process of identifying a representative. So that's good news.
Wonderful.
We still need someone from KAYAC, the Kentucky Association for Community Health Workers. But their annual meeting is, I believe, next week, their conference. And so maybe that'll be an opportunity for us to identify somebody.
I was going to say, if you have an email contact for them, I'm also very happy to reach out to them and help work on trying to get that position filled on my end as well. So maybe if we're hitting them from both ends, they'll get tired of hearing about it. So, because I've been working on trying to put together an association contact list as well. So that way, when there are vacant seats or inactive members, I know who to reach out to. So that is also something I've been trying to work on as well.
Yeah, that sounds like a good plan. I know that their board leadership changes from year to year. And so next week, I'll make sure I have the right person who's currently the president and connect you all.
Thank you, Emily.
Yeah, thank you. So the next item we have here is recommendations. I think I have a couple. Does anyone else have recommendations?
I have the one about the side-by-side.
Okay, why don't you, just state your recommendation in the way that you want it to be presented. Yeah.
Okay.
So I will say I'm taking care of that right now.
Okay, so we don't need to do it unless you just want to be like, check, we did it already. No, I think that's fine. Miranda, if you could also make it a recommendation that it just be an annual process.
That's a good idea.
Okay.
That DMS notify all CACs and connectors on an annual basis of the release of the Medicaid open enrollment side-by-side value-added benefits.
I think that's a good one. Well, I'll take a motion. I'll motion.
Okay.
Second?
I'll second it.
Okay, all in favor, say aye.
Aye.
Any opposed? Right.
Arthur has a question in the chat for Pam, I believe. He was asking, do you keep record of how many died on the waiting list?
Good question. Pam, are you still with us?
I am. Yes, I can. Arthur, yes, we do. We monitor it. I would have to request the report. It's not something I keep in a like standard report, but it's something that I periodically request the data and I have easy access to it. Also have access to the individuals if it's something you would be interested in, Arthur, the individuals that are receiving services on other waivers while they're on the wait list.
Yeah.
Okay.
I think that's also really good information for our policymakers, legislators in particular to have as they're making decisions about how many slots to fund. So Arthur, did you have any recommendations?
No.
Not at this time. Okay. So we've voted on one recommendation and that passed. The two that I have in mind, one would be that DMS post the network adequacy one pager on the DMS website and require each MCO to post the one pager on their respective websites. Can I get a motion?
I make a motion.
Thank you, Christine. Second? Second, Arthur? Thank you. All in favor, say aye.
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 Any opposed? All right, that motion carries. And my second recommendation, or our third altogether, would be that DMS create a pre-approval, well, let me start this over. That DMS create a process for Kentuckians to apply for emergency time limited Medicaid in advance of an emergency and be pre-approved to receive emergency time limited Medicaid in the event of an emergency occurring within a 12-month period from the date of their application. Does that sound right, Miranda? Okay. Yes. Can I get a motion?
I motion.
Second?
Second.
Thank you, Patty. All in favor say aye.
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 Any opposed? All right. Thank you all. And to reiterate there, we really do want to make sure that people can access the program. This wouldn't be an expansion of the program. It wouldn't change, you know, the requirements for someone, you know, to be enrolled and the types of the coverage or the benefits that they would receive. It would simply allow them to apply in advance of an emergency and be pre-approved for a 12-month period, because we think that a lot of people otherwise will delay or avoid getting care. And this would help us to make sure that people have an option for doing this, that they can initiate rather than being sort of at the mercy of the hospital or the provider that they may encounter whenever they're, you know, in that kind of emergency state, which is basically a crisis at that point, and may not have the information to enroll otherwise. So I think, any other recommendations? I think we've covered everything on our agenda at this point. In terms of MAC meeting representation, Erin, I think you just want to know who's going to be at the next MAC meeting to give the report. Is that right?
Yes, ma'am. Just that way, if I know ahead of time no one's going to be there, I can let Beth know, so she's not just waiting on somebody.
Yeah, that will be me. I'm sorry I wasn't able to be at the last one, but had multiple conflicts that day. That was just a day that everything seemed to be happening. So then the next item here, our 2023 meeting schedule. This is something actually that I think we should vote on. This would maintain the schedule that we currently have. So 1:30 in the afternoon on what I think is the third Thursday or third Tuesday of the month. Does anyone have a problem with that schedule? Of course, we can always, like Erin said, if there's one particular month that we need to change, we can always reschedule. But this will be the schedule for 2023. Can I get a motion?
I'll make a motion.
So
Arthur's motion.
Okay, Christine, thank you. So Miranda made the motion and Christine seconded. All in favor say aye.
Aye.
Aye. Any opposed? All right. And we do still have one more meeting this year, which is December 20th, and then a MAC meeting on November 17th.
I've not ever done a December meeting with you all. How does that fare, December 20th being pretty close to the holiday?
Yeah, that's a good question. If people want to consider rescheduling it now for earlier in the month, I'm open to that too.
I think it's always better to stay away within 5 days from that date.
Yeah. Do other people prefer doing something earlier in the month? Erin, would it be okay for us to email about the schedule with you?
Yes, ma'am. I can look at the schedule and give you guys some dates a little earlier in the month.
I think that would be a good idea. Yeah.
And then that way I can work around the other 15 TACs as well. So sometimes the calendars
Exactly.
get a little clunky.
Well, it may be that some of those TACs won't meet at all in December. Yeah, what if you could give us a few options, then we'll figure out the one that works best for us.
Sure. I'll send that in a separate email, not with all the attachments. So that way that can be a separate conversation.
Great. Thank you.
Yeah, if possible, keeping it on the same Tuesday at 1:30, that helps. You know, just a different Tuesday, not the 3rd, either the 1st or the 2nd.
All right. We will aim for that. So anything else before we adjourn? All right. Well, thank you all. We really appreciate it. And we'll be in touch.
Thank you.
Thanks. Bye.
Have a great afternoon, everyone.
You too.
Yeah.
Bye.